You make my world a better place. I can depend on you.
Are they here now?
Yeah.
At the Animal Hospital in Perth, Dr. Peter Ricci's first patient has arrived. Tabby cat Cleo with his owner Cheryl.
Hi, Cleo. Cleo's about 1.5 years old now. I got her as a kitten. She's a really lovely cat. She's really friendly and really affectionate. I really love her a lot.
But Cleo has suddenly developed a worrying lump.
Hi there, how are you going?
Hello.
My name's Pete, nice to meet you.
Cheryl, nice to meet you.
We've got Cleo in here, I believe. And Cleo has a little lump, I understand.
Yes.
So when did you first notice it,
I first
sorry?
noticed it this morning.
This morning, right, yeah.
And then by the time I got, here it is.
Hey, oh yeah, I see.
A lot larger. And she sort of, when you touch her, she starts sort of crying and she looks like she's really in
unhappy
pain.
about that. Has she had
Yeah,
any fights
yeah.
with any other cats?
Yeah, about a week ago she had a fight.
It's a bit hard to know exactly what's going on without having a look underneath the skin, but if she's had a wound there from a fight, something that's not too uncommon is for them to get an abscess. So, but we'll have a little check over of her. So let's have a look at the front of you, my dear.
That's it.
Good girl. Have a sneak in with my stethoscope and have a little listen to her heart.
Hey there. I've been concerned because my first cat died quite unexpectedly. So when I noticed this large lump growing on her back, I thought, I better take it to the vet straight away.
Ideally, what we would want to do with her is give her an anaesthetic so that we can have a look at that lump a little bit further. I am really hoping that this is an abscess because if it's not, something that could be is a cancerous lump. The main thing that we want to do today is investigate a bit further, make sure that what we're dealing with is actually an abscess, and if it is, clean it out as best as we can.
Cleo's such an affectionate cat. I really love her. She brings so much joy into my life, so I really get concerned when she's not feeling well. That's a girl. You're right.
All right, so let's get everything set up.
In Melbourne, Dr. Danni Dusek is joining a team of volunteers at Pets in the Park, a charity vet service dedicated to the animals of people who are homeless or at risk of becoming homeless.
Pets in the Park is everything that I signed up to vet for. I've always been obsessed with animals my whole life. And I got into veterinary science because I saw a homeless man with his dog and I desperately wanted to help and I could do nothing. And it really just sparked this desperation in me to be able to get some skills and help these people. So I love it.
Danni and vet nurse Serena's first patient of the day is 7-year-old Pitsy, much-loved companion of owner Mary.
How's little Pitsy going at the moment?
She's not doing too bad. She's here only for a checkup.
Wonderful. Hello, darling. Oh, we're a bit nervous now. We'll just have a little listen to your heart, my love.
At Pets in the Park, vets provide medical and dental checkups, as well as vaccinations, antibiotics and flea and worm treatments. Today, Pitsy is getting the works.
She's a good girl.
She certainly is.
Pitsy, she's my darling. She's my little girl. She's such a part of my family. I don't know what my life would be without her.
So the heart and lungs sound good, so we have no concerns there today, which is great. Now just have a little look in that mouth. Yeah, so we've got a bit of calculus build-up. Pitsy's doing really well, actually. She's got a little bit of dental disease, but not too bad considering her age. So she is down on our notes that she's going to need a dental at some point,
Yep.
okay?
Yes.
Mary is an absolute sweetheart. You can see in her eyes the love and care that she has for little Pitsy. They've just got such a beautiful bond. It's tablet time, so I don't know how she'll be with the parasite control. I have got one tablet that I will maybe pop down her throat if you're happy.
Yes,
is that
I think
okay?
you should do,
All
yes.
right.
She knows she has to swallow the tablet. She doesn't love them, that's for sure, but she has to have them.
Pitsy is a little bit of a nervous Nelly, so we'll just take it nice and slow. You ready? I know, it's a big one. Then you pop.
Yep.
Well done.
Well done.
Oh, you were
Well
very
done.
brave. She was actually really good. So that was good result. You were so brave.
It's been great knowing the pets in the park. She's been looked after for the last 6 months. Otherwise, I wouldn't be able to afford the medication, and I'm very fortunate to have this chance in my life. Hey, you've been good.
Danni's next patient is much bigger than little Pitsy.
We won't get him up on the table. He's too heavy.
That's a good call. Hello, you beautiful boy. Are you excited or nervous to be here, do you think?
Nervous.
How you going, Nala?
On the Gold Coast, Ashley is keeping watch over her pet mini pig Nala, who's just given birth to 6 baby piglets.
Good girl.
My friends thought having a pig was interesting, I guess, but I don't think anybody quite understands my little attachment to this pig. But to me, she's more like a dog or like an affectionate little animal.
She likes to suck on my hand.
Ashley has asked Dr. Alex Hynes to make a house call to check up on the new mum and her babies.
Nala had come into the emergency hospital. She was heavily pregnant and Ashley was a little bit concerned, so she wanted her checked out. I was a little bit sad that I wasn't there that night. So when the call came in today, we don't normally do house calls, but I was like, I'm getting in the car and I'm going out there.
Hi, Alex. How are you?
Hello, good.
Thank you for coming.
That's okay. Can't wait to see Nala and her babies. When Nala came into the hospital, all anyone was talking about was this beautiful pig. She was just like a dog. She followed Ashley around the hospital and she was just so well behaved. Where is she in there?
Nala.
Hey, Nala, I can hear you.
Oh, she's feeding.
Oh, she is too. Nala, aren't you clever? Look at you. Hello, my dear. Look at your babies. There's 6 gorgeous little piglets. I just want to pick them up and give them a cuddle. But I have to resist because Ashley's told me Nala is very protective. So many different colours as well.
Oh, good variety.
Yeah, and all reasonably the same size by the look of it.
Yeah, there doesn't seem to be like a runt or anything.
Yeah, no, that's really good because these guys don't get a lot of chance if they're smaller because she goes down, they have a feed, and one of them's a bit slower or a bit weak.
Yeah.
For miss out, so that's really good. An even size litter is exactly what you want, so that's great. While I'm here, I really want to check out these little babies, make sure they're in good health, but this could be fraught with danger. Really depends on how Nala's going to react when I pick up each of these babies to weigh them and check them over.
While Nala is momentarily distracted, Alex jumps at the chance to try to take a closer look at the piglets.
Ashley, have you named any of them yet?
No, they don't have names.
No?
No.
And how many boys, how many girls have we got?
This is a little girl, and this is the
That's
other girl.
the girl.
Yeah.
And all the rest are little boys.
Yeah.
So while Mum's busy, we might have a look at each of the babies.
Yeah.
And see if we can do that before she comes back.
Cool.
All right. Pick him up. Oh, he's very sleepy. Sounds good. Oh, I quite like it when he's fast asleep. I know once he wakes up, he's probably going to have a bit of a squeal.
Yeah.
So we'll just look under his back end there. It's nice and clean at the moment. Look at him, he's fast asleep. Hey, while you're asleep, my friend, we're going to pop you on there. Oh, this is great. Hey, he's even having little dreams. So he's 1.2 kilos.
Yeah.
Now that's really good. Anything over a kilo at this age is pretty good. But as I said, the main thing is that they're all about the same weight.
Okay.
That's what we're really looking for. Move on to the next little guy. Have a listen. Oh, here we go. I go to pick up the little girl and all hell breaks loose. Oh dear. Now we're not happy. Okay, she starts squealing her head off and Nala comes running.
At Pets in the Park in Melbourne, Danni and other vet volunteers are helping the homeless with their beloved animals.
The people that we see here, they love their pets more than anything on this earth. They'll do anything for them. They just want the best for them. really gets me choked up because they may not have anybody, and it's that pet that keeps them going every day. They will feed them before themselves. They'll go above and beyond for them. So it's such a privilege to be able to be there for them. We've got Kane here, have we?
Yes.
Shane is next with his 2 dogs, 10-year-old Labrador Amy and 2-year-old German Shepherd Kane.
Hi, Kane. Aren't you beautiful? How's he been going?
He is perfect. I just brought him in for a checkup.
So he's had a good appetite.
Oh,
He's happy in himself.
Yeah, he runs. I take him for a swim.
Oh, you lucky boy, hey? Well, let's check you over then, mate. Make sure there's nothing going on. Have a little look in these ears. Oh, excuse you.
Kane's like a teenager. He just mucks around. He goes everywhere with me. He sleeps on the bed if he wants to. Yeah, they're my life. And these people, they look after him really well.
All right, mate. Now we'll have a little listen to your ticker. Good boy. Shane's a real character with this big heart. Kane is full of beans and he's all about Dad. You can just see that they love each other so much. He's clearly very fit. Shane is doing everything to keep Kane in great shape. Oh, done, mister. Good boy.
Are you happy? Yeah. It's fit as a fiddle. You'll probably outlast me.
Next is Shane's other dog,
Come on,
Labrador Amy.
sit.
Hello, Amy Gill. Hi.
She's just over 10 years old.
Oh, you're a wise soul, aren't you, sweetheart? How's she been?
Well, she was 47 kilos last year.
Yep.
I don't know what she is now, but she's nowhere near it.
Okay.
She's lost a hell of a lot of weight. Put her on a diet.
You've been, oh, wonderful. Being overweight, technically obese, you can end up with lots of issues, including a decreased lifespan. So it really is important that we get her weight back under control. Have you had any lameness with her, any limping?
Yeah,
Yeah?
this one.
The front left one. Okay, we might actually have a look at how she's walking today.
Come on.
Okay, I'm just going to have a feel of this front left leg then, if that's been the one that you've noticed that's bothering her. I suspect most likely it's the elbow, and it is really common in Labradors. Unfortunately, she's likely to end up with arthritis in that joint.
That's why I'm trying to get the weight right off her.
That'll help take the pressure off the joint. Certainly we don't want that getting any worse. Carrying all that extra weight is putting so much pressure through her joints that's speeding up that process of osteoarthritis. So I'm just going to give Amy an injection, so that's just going to help with her sore elbow. It's going to give her some anti-inflammatory effects, so that'll help her, keep her a bit more comfortable.
My long term is just get as much weight off her as I can. Yeah, I've got to do what I can for her. You just got to look after them and do the right thing. It's all right.
All right, so a little pinch. Ready?
Yeah,
One, two,
she's
three.
all right with the needles.
Oh, darling. Oh, darling. Hopefully when Shane returns with Amy, we're a little bit more slender and hopefully she's a bit more comfortable in those joints now that we've started some medication for that.
All right, not a problem.
Sound good?
Yeah.
Beautiful. At the end of the day, Pets in the Park, it just makes you feel so lucky that you have the skills that you can actually help these people and their pets. It's a feel-good thing. I love it. Good job.
Is this Cleo? Is she a pretty cat?
At the animal hospital in Perth, Peter is about to anaesthetise Cleo the cat, who has a mysterious lump on her side.
Once she's asleep, we can investigate the lump a bit further by making an incision with a scalpel to see what tissue lies underneath.
Vet nurse Jordana will be assisting.
I'm just going to clip the hair on the front of her leg so we can find out where her vein is. All right. Yeah, a little prick. The procedure I'm about to perform is potentially painful, and I don't want her to be able to perceive that pain, so these drugs will make her sleepy and make that perception of pain go away. Good girl, Cleo. You're being such a good little kitty cat. I'm not usually a cat person, but Cleo is a gorgeous cat. All right, almost done, Cleo. Anaesthetic drugs tend to lower the blood pressure. We're going to put her on a drip, so that's going to give her fluid into her vein, into that catheter I've just placed. That will increase her blood pressure and make the anaesthetic procedure more safe. All right, you getting sleepy? There we go. Good girl. My next job is placing an endotracheal tube. What I want to do now is make sure that the tube is in her trachea. As she has a breath, I should be able to see some condensation inside of that tube. So this little white thing here is just a sensor for carbon dioxide. So every time she has a breath, one of these blue waves will come up on our monitor. 1 second. Oh no.
Cleo is having trouble stabilising under general anaesthetic.
Just a little breath hold now. Been a little bit of a problem with Cleo's anaesthetic. She stopped breathing by herself. We're going to have to help her out here. Keep a close eye on that. It was something that progresses very quickly.
Oh dear. Now we're not happy. Okay. Oh, she comes.
On the Gold Coast, Alex is trying to check newborn piglets. But new mum Nala isn't happy about being temporarily separated from her babies.
Nala comes cannoning into the pen and it's pretty intimidating.
Nala.
Oh, Nala.
It's okay.
I think we've upset Mum a little bit. It's okay. They're all fine, Nala. You're a good mum, Nala. You're a good protective mum, but you're a little bit intimidating.
Yeah.
I say, sorry, Mum, and just let her get settled, but I want to have another go. Little one. He's just right on a kilo. He's a good little guy. I know. I don't think I'll have any chance of looking. It's okay. So it's clear I'm not going to be able to pick up all these piglets. It's just going to stress Nala out too much.
Did you want me to grab the smallest one?
Yeah, let's try.
He's a sweet one.
Okay. Okay. I want to pick him up, put him on the scales and make sure he's not in the danger zone for weight.
It's okay.
Actually, how about you put this one on the scales and we'll just see if we can get a weight. She's the smallest. Is it she?
It's a boy.
It's a boy. So, yeah, just under, so 900 grams.
It's okay.
Mama, there you go. Oh, she's quick. Well, that's good. At least we got the smallest one weighed. So there's 200 grams difference between the heaviest one and the lightest one.
Yeah.
So that is a little bit of a difference.
Yeah.
So whenever possible to see that for that little guy,
Yeah.
that he's putting on weight every day.
Okay.
Because if the others get bigger and stronger, he could end up missing out.
Yeah.
It's so easy for the little one to get pushed out the way, not get enough food and fall even further behind. And I really don't want that to happen to this little boy. He is super cute though. I think he's my favourite with his little curled ears.
Yes, very cute.
So I think if we keep persisting anymore, Ashley, Mum's getting really upset now.
Yeah, yes.
So I'm happy that we've weighed the tiniest little guy.
Yep.
And we've checked them all out otherwise, so let's leave it at that.
Yeah, that sounds
good. We won't induce Mum's wrath anymore. Sitting here with these pigs, I'm beginning to think that having a pet pig is not such a bad idea.
Would you like to see what it's like to actually have a full-grown pig inside the house?
It can't be that bad, can it?
Have you got a BP going? There's been a little bit of a problem with Cleo's anaesthetic. She stopped breathing by herself. We're going to have to help her out here.
At the animal hospital in Perth, Cleo the cat isn't breathing properly, and Peter is struggling to get her stabilised.
As you first enter anaesthesia, you'll breath hold. So at the moment, Cleo is not having normal breaths. And every time I press a bag, she has a little breath of oxygen going into her. So when she's not breathing, we breathe for her.
It's okay, Cleo.
Hey, sweet pea. She's just having little breaths in her body. Beautiful. She's breathing herself now, so I'll let her do her thing.
Now that Cleo's breathing has finally stabilised, Peter can start investigating the lump on her side.
I'm expecting to see a swelling underneath the skin, and I can feel that it is quite extensive
But just as Peter is about to prepare the area for surgery, there is another scare.
This is not good.
Little Cleo's heart rate starts to drop.
She has got a little arrhythmia every now and again, but I think it's respiratory associated. Yeah, pop her just on half for a moment and we'll see how she goes. She's not got any reflexes, I don't think. So we have a little bit of a problem. The heart rate is dropping. That can be a side effect of the anaesthetic medications, and we've just got to get this period right to make sure she's at the appropriate depth of anaesthesia. Too deep and she's dead, and too awake, she's going to feel everything. And so there's that fine line that we need to get.
But before you go, I was just wondering, would you like to see what it's like to actually have a full-grown pig inside the house?
It can't be that bad, can it?
You'll be the judge.
All right, let's give her a try.
Okay.
At a home visit on the Gold Coast, Alex has fallen in love with a litter of new piglets. So owner Ashley wants to show her firsthand what it will be like if she gets a pig as a pet.
Does she know how to open the door, does she?
She does.
Oh, look at that. Oh, that nose. She looks like she's on a mission. Where's she? Oh, look at that. What's in there?
Food. When we first got her, she lived inside for probably about 6 months. She was toilet trained, so she would go in a little mat. And after a while, she just got real strong.
Hey, Nala. Hey, you in your old home. Oh, she's off to the kitchen.
So it just got a little bit too out of control. So we had to pop her outside. She wasn't too impressed at first, but she got used to it.
Oh my God, Nala! Oh my goodness! When Nala first came into the house, I thought not too bad. And then she decided she wanted to go out that door and bam, she just had the door off its hinges and she was out.
So that was her probably being quite well behaved.
Yeah, I might think about it. I think pigs make great pets, but they really need someone like Ashley to give a lot of love and a lot of patience. Come on, you got this. Come on.
In Bondi, Dr. Kate Adams is trying her best to be cheerful on her morning walk with her beloved golden retriever, Ben.
Bit of energy. You can do it. Come on.
Ben is a battler. 12 months ago, Kate found a lump on his shoulder that turned out to be an aggressive tumour, and he had to undergo 2 major surgeries.
We really had to go in fairly bold and actually take a lot of muscle, and it was pretty hard to see. Underneath that sheet was my dog. I thought that if they could just give me another 12 months, then I would be a very, very happy lady. And I thought, you know what? I've bought him some time and I've been able to give him, hopefully, another year.
Okay, ready, steady, go. Yeah.
Today is bittersweet for Kate. While Ben has made a full recovery from the surgery and looks a picture of health, recent blood tests show his liver enzymes are elevated.
Having high liver enzymes can be nothing. It could be just that he's old, but the fact that this is a change from his regular blood test rings some alarm bells for me. Come on, old mate.
Scared that the cancer has returned, Kate is taking Ben to the Sydney Emergency and Specialist Centre for urgent tests.
Hello, Dr. Kate.
Hello, how are you,
Lovely to see you.
Michael?
Nice to see you.
Nice to see you.
You too as well.
How are you?
Kate is meeting with specialist Dr. Michael Linton.
Please.
Come on, Benjo, let's go. I don't even think of Benny as a dog. I think of him as a family member. He has been with me since he's been about 7 weeks old, and we've pretty much been inseparable ever since. He has been with me through the whole adventure, everywhere from Queensland to the Northern Territory to outback WA, and now he is a Bondi dog. It's really difficult to tell with Ben when he's in pain, and it's really difficult to tell when he is unhappy because of the fact that he never complains. He always says that he's happy, and he does that for me. So, yeah, I feel like I owe him to try.
The previous bloods before the liver enzymes were normal?
Perfectly normal.
Okay.
Kate's a very diligent owner, and of course, but obviously a vet, and so she's been keeping an eye on the enzymes, and there has been a change. So I think, given Ben's history, it is a cause of concern.
First today, Ben is going to be given an ultrasound.
The ultrasound allows us to have a look at all of the organs, not just the liver.
Good boy, Ben. Good boy.
The concern is now that, has the cancer come back or has it spread anywhere? And that's something that, we need to check for. So we're looking in the lymph nodes. Also, given the elevation in the liver enzymes, we're going to have a good look at the liver as well. Alrighty.
If this is a return of the cancer, I'd be devastated.
Do you get a BP for me?
At the animal hospital in Perth, Peter needs to check a worrying lump on Tabby Cleo. But the young cat is not responding well to the anaesthetic.
So we have a little bit of a problem. The heart rate is dropping. It can be a side effect of the anaesthesia, and we're just making sure that she's not getting too low because obviously she could die. Green is good. She's coming back up now. Yep. Just keep an eye on the ISO.
With Cleo's heart rate stabilised, Peter can finally get started on the surgery.
It does look like it might just be a little tooth mark. You can see the wound that I was suspicious might be there. It's just this tiny little dot here. It does look like it might be a little canine puncture from another cat that could have introduced some bacteria. 1 second.
Suddenly, Cleo is in trouble again.
Her blood pressure's all of a sudden dropped. If she were to suddenly wake up, she would feel everything that's going on and it would be extremely painful for her. I need to give her some extra fluid so that her blood volume expands and we increase her blood pressure. The reason her blood pressure's dropped is more than likely because she's been under anaesthetic a little while now, and the longer you're under anaesthesia, the higher the risks. 0.2. Got another 0.2 there. She's looking like she's a bit more stable now. Yep. All right, so I'm pretty happy that this has had a decent clean.
Peter has managed to get Cleo stable again, so he can resume working on the lump.
I'm about to make my incision into Cleo's skin, and I am expecting there to be a bit of blood underneath one of the first layers of muscle. So I will need to make a little incision into that. So just like I thought, an abscess. So all that yellow muck coming out is her body's immune system sending white blood cells to attack foreign cells that are in her body. This has definitely been caused by a cat fight. Another cat has bitten Cleo, and the bacteria from that tooth has been introduced underneath her skin and caused the abscess to form. There's an immense amount of pressure underneath there, and that would have been causing an immense amount of pain for little Cleo. I'm going to flush out this abscess as much of it as possible. So that swelling that was once all the way out here has significantly decreased. So I am just going to place a couple little sutures in the corners, but we still leave it open that if there is any extra fluid, it will come out through the middle of this surgical wound. We will place a little cover over this to help absorb some of that ooze that's coming out. Once that's done, that should be the end of this procedure and we'll recover her. The two most risky times in anaesthesia is when the animal's going to sleep and when they're waking up. So even though Cleo's surgery is done, she's still not completely out of the woods just yet. He's a nice little cat.
There we go. Beautiful. Okay, we're good. Alrighty. Looks very normal on the left kidney so far.
In Sydney, Kate's dog Ben is undergoing an ultrasound with specialist Michael Linton to see if Ben's cancer has returned.
Okay, I can't see any abnormalities in the bladder. The bladder wall looks nice and thin. Whenever we're treating any of our friends or colleagues with their own pets, it does add another layer to it because, you never want to see someone, suffering. But at the same time, we have a job to do, and our job is to try and work out what's causing Ben's clinical signs. Now we're going to look at his liver, which was obviously a concern of ours.
Michael is looking for any obvious lesions or changes in the texture of Ben's liver.
The liver's not entirely normal, but it doesn't ring true of any obvious infiltrative disease like cancer.
There's no mass on there?
No, not that I can see.
It's like this horrible game of waiting. And where is it going to come back and when is it going to come back?
Next, Michael is moving onto Ben's adrenal gland.
So the adrenal gland on the left side, although it's got a normal shape, it's a little bit larger than a normal adrenal gland. So we'll have to look at the adrenal gland on the other side. So we need to actually roll him over.
Go, matey.
Very good.
Push you down. There you go, Chook.
So I'm looking again at his liver. And again, it has a very similar appearance to what we're looking at on the other side. It's possibly a little bit more coarse than usual, but I can't see any obvious lesions or growths.
Such a good dog.
So, Dr. Kate, we found the other adrenal gland, and this gland is also larger than it would be in a dog with normal adrenal glands. That can be consistent with a condition called Cushing's disease.
Old dogs often have things wrong with them. All you can really actually hope for is that you find something that is treatable.
You're okay, I'm right here.
Hey, sweet pea. Little Cleo's starting to get some of her tone back at the moment.
At the Animal Hospital in Perth, Peter is closely monitoring little Cleo as she wakes up from surgery on a nasty abscess.
She's starting to show the first few signs that she's gaining her reflexes again. What I'm watching for is her to actually take a swallow, even though she's moving her head around. Once she's moving her tongue and she's swallowing, that indicates she has a gag reflex. Hey, sweetie, you gonna have a swallow? There we go. And once she does that, I can remove the tube. Welcome back. Before she all of a sudden becomes aware of her surgical site, and we're going to place the e-collar around her neck, little Cleo is going to have to wear the cone of shame because she's more than likely going to lick her wound and reinfect it. Vet's orders. I don't know, she'll be too impressed with this. But... So she'll recover in here for about an hour or two. When she's a bit more awake, we'll hopefully send her home. Rest up.
Come on, guys. Come on, guys. Good boys.
On the Gold Coast, Good Samaritan Millie has just found 2 strays.
I just found these little guys running on the motorway.
Sure, look at these 2 handsome boys. Do you want to just have a seat or get a vet to come out and help you, okay?
No worries.
Thank you.
Come on. Come on, guys. I was driving home from work and found these 2 running on the side of the road, being on a main highway. I was a bit panicked, but I had to pull over. I'm a massive dog lover, so I had to get them to a safe place. I probably risked my life a little bit, but I think anyone else would probably do the same in the same situation.
Good boy. Yeah, I know. You're right.
Alex is back from her home visit and has come out to meet the runaways.
Hello. Hi, how you going?
Oh, look at you 2. What have you been up to? Hey?
So I just found these 2 guys on the motorway.
On the motorway?
Yes, yes.
Wow.
So I just quickly pulled over and opened my back door and they both hopped straight in.
And they just jumped straight in the car?
Yeah.
Into the safety, really.
Absolutely.
If they're out there on the road, it's a danger to these poor boys, and yet they're unscathed.
Absolutely.
Hopefully we can find their owners. What we'll do is we'll scan them for a microchip. If they've got a chip, we'll call the owner, get in contact with them and hopefully get them safely home.
Wonderful, that would be great.
All right, I'll take them off your hands. We get lots of dogs come into the emergency hospital as strays, but that was such a brave thing to do.
Bye, mate. Yeah, see you, buddy.
You know, we call them Good Samaritans. They really go above and beyond to make sure that dogs like this get safely home.
Oh, hello.
Vet nurse Tara is going to assist Alex with the microchip scanner.
All right, let's see if they've got a chip.
Yeah, cool.
Be able to find out who you belong to. You can really tell these dogs just love affection. They clearly have a very loving home somewhere. We just got to find it. I see so many strays that come in without a microchip, and it makes me so sad because there must be families out there who are really missing them, and there's no way for us to find who those families are. 2 cheeky dogs, a long way from home.
So we found the other adrenal gland, and this gland is also larger than normal adrenal glands.
In Sydney, specialist Michael is trying to find out why Kate's beloved old dog Ben has elevated liver enzymes. Kate is scared it's a sign that his cancer has returned.
That can be consistent with inflammation, but can also be consistent with a condition called Cushing's disease. Cushing's disease is when there's an overproduction of the hormones from the adrenal gland. Probably the biggest one is something called cortisol. Cortisol is probably referred to as the stress hormone, and we need it to live. But when we've got excess amounts, there can actually be some serious complications if that's not managed appropriately.
I think that no cancer is really the best news.
Yeah, that's right.
Cushing's disease is something that I can manage. It's something that I can treat, and that is a good thing. Cancer is something I can't. Cushing's is often progressive, so it can really affect an old dog's quality of life, meaning that treatment is really essential. But in older dogs, anything that you can treat and they are going to live is a good diagnosis.
But Ben can't be given the all clear just yet. Michael now wants to do a CT scan to make absolutely sure there is no sign of Ben's earlier cancer.
The CT scan, offers us the most sensitive way to pick up any evidence of return of that tumour in the chest being spread or in the original surgical site.
Good luck, Benny. You'll be fine. I'm feeling really nervous about putting him under.
Good boy.
You've got to watch out for general anaesthetics in older dogs.
Kate won't be able to relax until she knows that Ben is cancer-free.
I feel like a bit of an overprotective mum at this point.
The best case that I'd be hoping to find with Ben is ideally nothing at all. But unfortunately, cancer can hide away. They're tiny little cells, and there is still a chance that it will rear its ugly head again.
I think that if it turns out that this cancer is spread and it's through his lungs and it's something I can't operate on, then I'll make that call fairly early. While he still has all the quality and the happiness he has now.
All right, let's see if they got a chip.
On the Gold Coast, Alex and Tara are anxious to find the owners of two lively young Staffordshire Terriers found running loose on the highway. They're hoping they've been microchipped.
Oh, that sounded promising. That's one. You got a chip? Yeah, we sure do. Awesome. Let's see if the other boy's got a chip too. Yeah. Hey. Ah, 2 from 2. Good job. I like that. I'll go get some information from the microchip company and I'll let you know who you are. All right. I think this is the quietest I've seen you boys be. We just keep it like this. That'll be good.
Microchips each have unique numbers, which are recorded on databases that store the owner's contact details.
How'd you go? Yeah, good. So we've got some good news. This lovely man is Max, and this naughty little monkey is Chaos. Chaos. I could see that. Yeah, so they both come from the same family. Oh, that's so good. Chaos is a perfect name for this boy. I reckon he's the one who's led everyone astray. Yeah. Hey, are you the troublemaker? I think you might be. Got to make a couple of phone calls, I reckon. When you make that call, you'd never know. Sometimes they've had a chip since a puppy and they've gone to a completely different owner or the chip's not registered.
If the owners can't be contacted, Max and Chaos may have to go to an animal shelter until new owners can be found.
But look how friendly they are. That's so nice, yeah. They're such sweet dogs.
Good boy.
I'm very tired.
In Sydney, Ben's CT scan is over and it's time for Kate to talk through the results with specialist Michael LINTON.
So Kate, so far the preliminary results looks very positive at the moment. There's no evidence of a growth, there's no evidence of return of the lesion. All looking very, very positive.
This is good.
This is as good as we could hope for at this point, absolutely.
Yeah. There is no reoccurrence of the cancer at this stage, which is excellent news. Thank you so much for looking after him. This has been super useful. If Cushing's is the only thing wrong with him, then that is a good thing for me.
That's right.
It's a manageable situation. It means that then I'm not having to deal with cancer.
Absolutely.
It's a good thing. Hey, mate.
Come on, wakey wake. Wakey wake. You can do it. Come on, wake up. Have you been good? Do you want some breakfast? Do you want to go to the park? You don't want to go to the park? No, I'm too tired.
I am feeling so relieved. I feel like I can put this unease about the cancer coming back to rest, even if it's just for another 6 months.
Big hug like this.
This love affair is not quite over yet.
We've been playing tug-of-war all day.
On the Gold Coast, Alex and Tara are using microchip technology to try to locate the owner of Max and Chaos. The two boisterous Staffordshire Terriers were found wandering on a busy highway.
All right, let's try and give Julie a call. Hi, is that Julie?
Yeah.
Hey, Julie, it's Dr. Alex Hynes here from the Animal Emergency Service.
Yeah.
Do you have two doggies called Max and Chaos?
Yes, I've been looking for them. Are they okay?
They are fine. A lovely lady picked them up. She popped them in her car and she's brought them down to us.
I've been driving around looking for them everywhere. About 2 hours.
Oh, wow, you must have been so worried.
I was. Thank God I got them checked.
That's a great result. Julie, you'll be happy to see these two. You can tell from that phone call that they are just trouble, but I think she's just relieved.
Owner Julie hasn't wasted any time coming to get her boys.
When I heard from Animal Emergency, I just thought, definitely they've been hit by a car.
Hello.
Hi.
Julie, is it? How are you?
And then she's like, oh, they were picked up on the gateway. And I was like, what were you doing on the gateway? How did you get there? I still can't believe it.
Who's that? Where's your been? Hi, Chaos. Where have you been? The way they play with each other.
So rough.
Yeah. Yes. When you first meet them, you think Max would be the boss.
No. Chaos is the boss.
Yeah.
Yeah.
He makes all the decisions.
Yep. Max is just the follower.
Yeah.
I'm blaming Chaos all the way. He's the troublemaker of the bunch.
Alex has a theory about why the boys ran away.
I noticed they're carrying an extra pair there, both of them.
Yes.
Have you thought about getting them the snip?
They were meant to be done ages ago.
Because I'm thinking maybe they
That would
were
help.
after a lady. Maybe.
Oh, that's entirely possible.
Tara and I are both on the same page that we think these two boys could definitely benefit from having the snip. They're still going to be personality plus, but it's probably going to settle them down a bit, especially that Chaos.
See you later.
Say bye.
Look who's here, Cleo. It's okay. She's not too happy with me. Look who's here. Look who's here.
In Perth, little Cleo has recovered from surgery, and Peter is happy to report that the lump was an abscess and not cancer.
It's been a long wait. Yeah, I've been a bit worried.
So she's done really well. It's lovely to see Cleo reunite with Cheryl. Cheryl clearly loves Cleo quite a lot. She's got a nice little laceration here from her surgery. She did have one little puncture wound there that looked like where a tooth has probably gone in, so I'd say she has had a little bite from another cat.
Cleo will have to be on antibiotics for the next 10 days to help clear up the infection, and outdoors will be out of bounds.
The best way to prevent Cleo from fighting in the future is to actually keep her indoors. There we go, a bit more safer in there, isn't it, darling? All right, so she's all ready to go home. This is definitely one of the better parts of the job, being able to return a happy, healthy cat to her loving owner.
Yeah, thanks very much, Dr. Pete.
No dramas, my pleasure.
Let's go, Banana, this way.
In Bondi, it's been a week since Kate's dog Ben was confirmed cancer-free.
Good dog, right next to me. Right next.
And a very relieved Kate has been spoiling her special boy.
There we go. I think every day is a Pamper Benny day. Hey, Benny, do you want some dinner? You do? I know the type of cancer he had. I know that grade 3 sarcomas, they don't go away forever. And there's going to come a day where I have to say goodbye to him. And when that happens, I feel like I gave him a really good run. I gave him the best that I possibly could.
Do you want one of these? Which one do you want? Do you want this one? Okay.
Tests have confirmed that Ben does have one major health issue, Cushing's disease, which affects the adrenal gland. but can be managed successfully.
Every day is a blessing.
Did you finish yours already? I want this one.
I feel like a really lucky lady to just even have a little bit more time with him. You're a good dog.
Hi, I'm Dr. Danni Dusek from Bondi Vet. If you love our show and want to see more, plus some amazing content about pets and how to care for them, hit the subscribe button. Click that little notification bell and we'll see you on our next video.